tumors completely dissolve. That is a 100% success rate, with 0 relapses recorded years later. This trial specifically targeted bowel cancer, also known as colorectal cancer. Globally, this disease ranks as the second leading cause of cancer deaths, making the search for a reliable cure one of medicine's most urgent priorities. But the most striking outcome of this trial is how these patients achieved total remission. They did it without using a single drop of chemotherapy. This trial provides evidence that the long-standing reliance on toxic chemicals to treat these cancers may be reaching its end. For decades, the standard medical response to bowel cancer has been consistent: cut it out. Surgery has always been the immediate, primary intervention. That surgery is typically followed by a second, grueling phase. Patients endure months of chemotherapy, designed to mop up any microscopic cancerous cells the scalpel might have missed. Even after enduring both a major operation and months of chemical treatment, the cancer frequently returns within a few years. For many, the cycle of treatment simply begins again. The challenge in oncology has always been the collateral damage. Historically, we haven't been able to eradicate the cancer without significantly damaging the rest of the patient's body in the process. A team of researchers at University College London challenged this traditional sequence, launching the NeoPrism CRC trial for 32 patients with bowel cancer. Instead of reaching for the scalpel first, doctors inverted the timeline. They administered an immunotherapy drug called pembrolizumab for 9 weeks to prime the immune system before surgery was even considered. Nearly 3 years post-surgery, no patients in the trial have experienced a relapse. Because the initial immunotherapy was so effective, the researchers were able to skip the standard post-operative chemotherapy entirely. By flipping the timeline to prime then cut, the trial demonstrated a path to clearance that avoids the long-term toxic burden of standard chemotherapy. 10 to 15% of bowel cancers are MMR deficient, packed with mutations acting like vibrating warning markers. But tumors hack our immune cells, casting a biological tether that breaks our natural defenses. Pembrolizumab specifically severs this tether, removing the tumor's inhibitory signals. Once that block is removed, the effect is immediate. The body's natural defenses can finally recognize the threat and quickly move in to destroy the cancerous cells. The drug doesn't kill the cancer itself, it simply restores the immune system's native ability to eliminate the threat. One 73-year-old patient in the trial was diagnosed with stage 3 bowel cancer and received just a few initial doses of the immunotherapy. When the surgical team finally operated, they found that the cancer had essentially melted away. There were no active cancer cells left to remove. The result is total remission, without the lingering side effects of chemo, an outcome that suggests high-risk bowel cancer could eventually be managed with far less trauma to the patient. But how can scientists be certain the cancer is truly gone? Even microscopic traces left behind are often enough to trigger a relapse. The researchers used personalized blood tests to find out. These tests hunt for tiny, specific fragments of tumor DNA circulating in the patient's bloodstream. The total disappearance of these signatures provided objective proof that the cancer had been cleared at a molecular level. Rather than guessing if the surgery was successful, doctors can now use these fragments to verify the total biological absence of the disease. While every patient in this specific group saw their cancer disappear, it is important to remember this success currently only applies to the subset of tumors carrying this specific genetic signature. However, the research team is already planning to expand this approach. By using personalized genetic profiling, they hope to identify exactly which patients can safely skip chemotherapy and who may require additional interventions. By mapping the specific genetic flaws of a tumor and directing our own immune system to attack them, we are finding ways to outsmart the disease, bringing us closer to a future where cancer can be treated without the need for toxic chemicals.